Welcome to Adapting Class. In order to master lab value, you have to think about it, not just the norms, but critically think about it, how the board will give you questions related to that. It's part of medicine. Learn how to answer questions regarding lab value, thinking critically. This is the first question. What do we have? Which of the following medication the nurse should stop immediately? A client with CHF, congestive heart failure, has digoxin level of what? 2.5. What do you think? Rewrite the question again. I have a patient with a digoxin level of 2.5. Which medication should I stop? Stop it immediately. Then you bring your content. You say, what? If you're on digoxin, what is the things you should avoid? These are the things that you usually know are affected. Your potassium, your calcium, your magnesium are those electrolytes you worry about, right? Potassium, if it's too low, it becomes a problem. Calcium, if it's too high, it becomes a problem. Magnesium, if it's too low, it becomes a problem. I know nitroglycerin does not affect any of the electrolytes, right? Atorvastatin does not affect any of these people. Aspirin is all bleeding. Furosemide will decrease your potassium. And guess what? This is toxic level. You have to hold digoxin, but you don't want to give them anything that will make this more toxic. You're already 2.5. They are in the toxic range. If you decrease their potassium, become more toxic. Therefore, what do you want to do? Stop furosemide. Critical thinking. That's all. Next question. Same strategy. Which of the following lab value the nurse should notify? Notify the MD immediately, medical doctor immediately. You select or apply, right? A client with congestive eye failure is on what? Digoxin. Which of the following lab value the nurse should notify the MD immediately? I already given you the answer on the first question. You just building up on it. Make sure your calcium is normal. Make sure your potassium is normal. Make sure your magnesium is normal. Calcium 12 is too high. Potassium 3.3 is too low. Magnesium 1.1 is too low. Sodium does not affect digoxin that much. Creatinine can affect digoxin because the kidney clear digoxin. You have to have a normal kidney function. 1.1 is normal. Test taking strategy based on this, what I've told you. Which one do you think is a problem? Too much calcium, too low potassium, too low magnesium. Those ones need to be notified to the doctor immediately before you have toxic level of digoxin. Straightforward, right? Next question, same strategy, attacking question. What lab the nurse should expect? I expect the lab to be ordered. A client with what? Recurrent DVT and on long-term Coumadin. Present to the clinic for follow-up. Client has not been taking the medication for a week. Rewrite it. Just focus on the buzzwords. Client with DVT on Coumadin has not taken medication for a week. What do you expect? You see 4 numbers. I put it together. It's a trap, just trying to make you think. If you take Coumadin, there's only one lab work we check. If you have not taken it, I want to make sure that your INR has not dropped too low or your PT is not too low so that we can admit you and get you to the hospital and bring them up before you develop DVT. Bleeding time, people get confused. This is our platelet problem. PTT, this is heparin problem. PT is Coumadin problem. Patient is not bleeding. Right answer is PT, right? So that's the one we have to check. Number 4. What is the most important priority lab the nurse should expect to be ordered? What is the problem? A client on Valproic Acid for bipolar present to the clinic with what? Mid-epigastric pain, buzzword, that radiates to the back, and nausea. What is the most important lab the nurse should expect to be ordered? Think about it. Rewrite a question with your buzzword. Valproic acid for bipolar. Now, all of a sudden, I have mid-epigastric pain that radiates to my back and I have nausea. What do I expect? What is your diagnosis? Well, you go by what is asked, what is the keyword, and then what is the buzzword, and you put it together, you realize this patient has what? Pancreatitis. That's the side effect of valproic acid. If you have pancreatitis, what lab work you want to do? I keep on telling you guys all the time, never look at the answer choice until you figure out what you think you're expecting. I know what I'm expecting. Lab work for pancreatitis. Complete blood count is not going to help me. Basic metabolic panel is not going to help me. Complete metabolic panel is not going to help me. Amylase and lipase is the one that will help me. That's my answer. Number 5. Same thing. What should the nurse expect? What do I expect? Select and apply. 20-year-old G3P2. That means still pregnant, 20 weeks. Present to the OB clinic for prenatal care. The alpha fetoprotein was twice normal, so it's more than normal. It's what? Elevated. What should I expect? Concept you're supposed to know. When your alpha fetoprotein is elevated, it's significant. It signifies certain things. It may indicate, the word is may, or something is not right. This is usually done in 20 weeks. Why? It's a secondary prevention. What is secondary prevention? It's a screening test. So if I'm screening for something, if I see this, it may indicate that you have what? When your alpha fetoprotein is high, it may indicate an encephaly. It may indicate what? Spinal bifida. But it does not mean you have a diagnosis of it. It does not mean that you will be diagnosed with that. It means that when we see that, we need to confirm it. Confirmatory test is amyloicentesis. You can order MRI, but there's a better choice you can do. It's amyloicentesis. When the alpha fetoprotein is high, it does not, you cannot make diagnosis of Down syndrome. Down syndrome is usually alpha fetoprotein is low. So what is your right answer? It's a select or apply. The baby will not be diagnosed with encephaly. The doctor will not diagnose the baby with spinal bifida. MRI is not going to yield anything. We need tissue. Tissue requires biopsy. The doctor biopsy. The baby will be diagnosed with Down syndrome. No, alpha fetoprotein is too high. There's only one answer choice. Pick those that you know you're confident. Don't keep on picking if you have no clue. They will not take a point from you if you pick those that you know. If you don't know, just leave it. You won't be penalized. You will not gain that point, but it's better not to have all your points deducted than not getting any more points. So that's my answer, number 4. It's a screening tool, so we order another test to confirm it, confirmatory test. A 50-year-old client was found to have hemoglobin of what? 11.5 on a routine lab drawing yearly physical. Patient has no symptoms. What should the nurse expect? Rewrite it. Asymptomatic patient with anemia. This anemia is 11.5. What is the most likely the problem? Give them iron tabs, green leafy vegetables, transfuse them, or refer them to colonoscopy. An adult with anemia and he has no symptoms, you see what I did? Adult, anemia, no symptoms, is colon cancer until proven otherwise. Get your colonoscopy and figure out if there's anything there. If not, yeah, then we give you iron. But we got to figure out that you may be bleeding chronically. Number 7, a nurse is caring for a client who developed tonic-clonic seizure, buzzword. Drawing what? Morning assessment. Which lab value the nurse should suspect to be the possible cause? Patient all of a sudden has tonic-clonic seizure for no reason. What do you think will be causing it when you get the lab work? You got to know this lab work. All this lab work, they're very straightforward. You know it. Sodium that is low is a prone for seizure. This is what you see in syndrome of SIDH, right? Potassium 4.3 is normal. Calcium that is low, yeah, it's excitatory. That means it stimulates things. Your brain will be stimulated. You go into seizure. Magnesium 2 is normal, and BUN is normal. So for which one is it possible? It may be sodium or calcium related. Next question, number 8. Selected apply. Which of the following medication the nurse should question? I need to question it. Think about this question. It's a little bit hard. A nurse is caring for a client with potassium of what? 5.7. Rewrite the question. I have elevated potassium. Do I want to increase potassium, okay, or I want to decrease it? I want to decrease it. Valproic acid. Do you know what it is? It's a loop diuretic. What does loop diuretic do? It decreases your potassium. I'm okay you taking this. This will decrease your potassium. Furosemide. Furosemide is what? You can see the last name. Furosemide. It's also a loop diuretic, and it will decrease your potassium. So which medication you should question? You don't need to question this. You don't need to question this. Renal. This is potassium-sparing. If I'm going to spare potassium, my potassium is going to increase. I already have 5.7. Therefore, I got to question this. Amyloride. If you've seen this before, it's easy. Amyloride is a what? It's a diuretic. But it's what? A potassium-sparing. The same thing. Increase your potassium. We got to question it. And naloxone is an ACE inhibitor. One of the side effects of ACE inhibitor, they are potassium sparing. It's going to increase your potassium. So thus we got to intervene. So 3, 4, 5 should be intervened. Next question. Number 9. Select or apply. Which of the following lab value is consistent? It shows with the disease process. A nurse is caring for a client with end-stage liver disease. Which one shows consistent with it? Your liver does a lot of things, and when it's affected, there's certain things that you lose. Okay, platelet is related to the spleen. The spleen, if this is the liver, and the spleen is sitting here, the spleen sends all its blood to the liver. If this is the liver is diseased, there's no more. You can't send all your blood. So the spleen get bigger. If it get bigger, it chew your platelet. So your platelets become low. So in liver disease, severe liver disease, platelet is not high, it's low. Your INR related to your clotting issue is going to be high. Liver disease control the PT because of the factors that you make. It has nothing to do with the PTT. Bilirubin, yes. Bilirubin is related to hemoglobin. It's going to go high. And ammonia level, we all think ammonia is supposed to be high. But I believe it's supposed to be normal as much as possible because these patients, they're taking medication to help with that. When we see high ammonia, we should see what? Encephalopathy. So when I see a patient who is in end-stage liver disease, I expect the ammonium to be with it because they'll be taking lactulose and other things. When we see high ammonia, they will be in encephalopathy. I've never seen anybody with the end-stage liver disease already in encephalopathy, unless they develop what? High ammonia. The ammonia level goes up. Ammonia level goes up when it becomes a complication. So those one, you don't see it all the time. So it can go anyway. Somebody will pick this, it's fine. But let you know that when you see ammonia, they're sick. Just normal end-stage liver disease patient, their ammonia level will be a little bit high normal, but not to the level of that high. So I'm going to keep number 3. So this is 3, this is 4, and this is 5. So that's what I would keep. Number 4 is the yes. Number 10. So a client whose diet is consistent with what? Avocado, kale, potatoes present to the emergency room with weakness and lethargy. EKG shows wide complex QRS complex, right? Which of the following electrolytes the nurse should suspect to be the possible cause of the client's condition? Just go back again. Which of the following electrolytes, okay, the nurse should suspect to be the possible cause of the client condition? What happened? A client whose diet is what? Eating avocado, kale, potato, went to the emergency room because of what? Weakness, lethargy, and EKG shows Y complex QRS. What do you think? Avocado, kale, and potato, they are high in potassium. That is why a patient is weak and lethargic. And when your potassium is really, really, really high, you see not the the peak T wave you see is the beginning. It can progress to YQRS complex. That means when I see this, potassium is very, very high. Therefore, that's my right answer. The rest, this causes most of the time QT prolongation or shorting Q. Magnesium, almost the same, but sodium effect is not that significant. Number 11. A client with recurrent pulmonary embolism is seen at the hematology clinic for routine follow-up. Client is on what? Apixaban. Is on Apixaban and feels well. Which of the following is appropriate? Rewrite it. I'm taking Apixaban. That's all, and I'm fine. I have pulmonary embolism. I'm taking it. Which one is appropriate? Check my PTT. It's a trap. This one, you don't need any lab work. Check my PT. This one, you don't need any lab work. Encouraging increasing green leafy vegetables in diet. This one, you don't need any diet modification. What you need is a breathing precaution. Use electrical shaver. Avoid steroids. What does steroid do? It causes gastritis. It causes ulcer. And if you're taking this, Apixaban, you're going to bleed. So avoid steroid and use electric shaver. Straightforward, right? Number 12, a nurse is caring for a client with what? Prolonged bleeding time. This is really a difficult question. I know a lot of people will choose certain answers. Which of the following the nurse should suspect? Select or apply. Big buzzword is bleeding time. There's a difference between bleeding time and clotting time. So this is what happened. When you catch yourself like that and you bleeding, blood is pouring all over. There's people that come in first and patch their hole. They patch it. They call them plug. They plug the hole that is leaking, and that stops the blood from bleeding externally. But it doesn't mean you're not bleeding internally. The blood is not, the hole in this thing is not completely patched. They just plug it temporarily. If you continue to fill, it's going to rupture. Plugging, initial plugging is what we call bleeding time. How long you bleed before you don't see anything anymore. That is bleeding time. And whatever is involved is mostly platelet. After the platelet come and patch that hole, your clotting factors, all the factors come together and they form clot that completely seal it forever. That one is the clotting time. And that one is related to, that is what Coumadin affect. That's what heparin affect. So which of these will lead to prolonged bleeding time? Anything that affect platelet. Coumadin does not affect platelet. Heparin does not affect platelet. Uremia, yeah, renal failure, it makes your platelet not to function well. Your bleeding time goes up. Aspirin block your platelet for 7 days. So bleeding time is increased. Von Willebrand disease is a disease that have factors that affect platelet. That one too is a problem. Therefore, bleeding time is related to platelet function. Anything that affects platelets is your right answer. So don't choose number 1 or 2. And I know people will choose that, but this is the teaching moment. 3, 4, and 5. Okay. Number 13. Selected apply. The client presents to the physician office for routine physical. CBC shows what? Hemoglobin. You have hemoglobin of 17.5. Which of the following the nurse should suspect? This is too high. What is going to increase your hemoglobin to be too high? Colon cancer, you're bleeding. Your hemoglobin, you have iron deficiency, anemia. You're not going to have elevated hemoglobin. Gastric ulcer, this is test-taking strategy. You're bleeding. Your hemoglobin is not going to be that high. If you live in a higher altitude, your oxygen tension is low. What does your body do? It makes more red blood cell to attack the little oxygen that you have, and you can do well. This is why people from Kenya and other places, higher altitude, they can run faster for a long time because they have a lot of hemoglobin, and it can suck all the oxygen available, and it can last longer. Some people go and train higher altitude to get this kind of stimulation of hemoglobin. When you dehydrated, yes, you get that. Steroid use, anabolic steroid, you stimulate red cells. That is why athletes use it so that they can exercise much better. So that's one. So 3, 4, 5 is what I expect. Okay. Number 14. And the last one. A nurse at the med-surg clinic is returning phone call from client. Which client situation need immediate phone call? Priority, immediate phone call. A client on what? Triamethrin and potassium is 3.5. This is case-sparing. The potassium is too low. It's normal, but it's low side. This is going to increase it. Why do you have to worry about it? Ignore it. This is not being sharp. You have to be sharp. A client on Coumadin for prosthetic valve and INR is 2.8. When you're on prosthetic valve, INR is 2.8 and what? 3.5. No, 2.5 and 3.5. This is within normal range. Don't worry about it. The client on Coumadin for DVT and his PT is 40 seconds. Normal PT is 10 to 13. If you're on Coumadin, you multiply this, you go probably 15, this by 1.5, and this is 2 to 23. 26 seconds. This is what is supposed to be when you're on Coumadin. 15 to 26 seconds. 40 is too high. I have a problem with you. A client on lithium and sodium is what? 150. This is also too high. When you're on lithium, I want sodium to be normal as much as possible. 150 will make your lithium go down, and what will happen to the patient? It will become maniac. It will be in your hospital in maniac episode. Therefore, they need phone call. 3 and 4 need phone call. This is the end of it. Like I told you, critical thinking, overstretching lab value to let you think what you need to know. Or the best of luck. If you don't subscribe to Adapt NCLEX, you look down, you subscribe to the Adapt NCLEX, and you get more content like this. We have membership with high yield content that you will never find anywhere. Join our membership and you'll be golden. Take care of yourself. All the best of luck. Bye-bye.